my carer is also my partner. How do people usually manage that balance, and how might my condition or treatment affect my relationship with my partner? Have you got anything else you want to add, Trudy, about that, or shall we
Yeah,
open
I think if they are still fairly able, that they can go places, still do things, then I think if you can still do nice activities together, whatever they might be. Maybe, you know, they can't go out for long, but even just sitting in a garden together, it's that quality time. Try and get life as normal as possible. Even just shift into a different room, if that's a possibility, where it's a nice sofa, and maybe they create the atmosphere as though they're at the cinema. So get the lights off and close the curtains, gadgets out the way, put a movie on, make some popcorn, eat chocolate, whatever it might be. But to create nice quality time where you do other things. Maybe you can't do what you used to do, but what we have to do is adapt rather than feel so much sadness for what we've lost. It's what can we do now, and not focus so much on performing, but on participating in what's able, really. So it's separating that time, quality time, creating the atmosphere, still doing things together, I think is just as important.
Thank you, Trudy. Chris, have you got anything to add?
Yeah, I find the specifics very interesting, but coming from a general background, I tend to think about the more chronic picture, how the patient and the partner have got here, and everybody's an individual in that sort of thing. But whatever's happened, chances are that patient and partner have been through an awful lot and have been extremely ill, either suddenly or gradually got worse. You're thinking about this now on the ventilator because you're feeling better. That's an important thing. You've got to be feeling better. And I think what comes from that is that each patient and each carer's history may not be at the same place. So I think what's really important is the two individuals think and talk about what they would want, what they would like to try, and just try and be open with each other, but also keep a sense of humor. You know, the act itself is absolutely ridiculous. So, you know, let's have a laugh as you go along and relax and find out what you think might work for you. If that means doing it on your own, fine. But then introduce something else into with your partner. But it's important that you start the process because you're in parallel. Your ship's in the night in parallel, and you want to bring these two ships together, so they're the same speed, thinking the same things, and hopefully getting something out of it. I would actually also say, if you're getting something out of it, that's great, and you can build on it. It's not going, you know, the fireworks aren't going to immediately go the first time you try something, but build on it and learn and find out what people like, and keep talking, keep thinking, and keep smiling.
And I think you're absolutely right. I think that communication element can sometimes be really challenging, can't it? Because in relationships, when somebody's become unwell or because they've had a significant change in their health status, it really alters the balance in relationships with caring and with responsibilities. And the person who might be supporting the family both domestically and financially, there might be, you know, there's fatigue. It's such a complex issue, and you're absolutely right. You can't unpick it, and there's not a one size fits all. And I think
the patient on the ventilator may be feeling much more relaxed and much better than the carer, or the partner, because they're still waiting for a wheel to fall off. So absolutely, it's important that everybody gets on board and starts the process. It's not a let's throw the snakes, let's throw a six and let's see what happens. It's important to work through it. And also from a clinician's point of view, I think it's important that if possible, you keep your poker face on, because there's nothing so surprising as what patients will tell you. You know, and you may go, really? But actually, what you've got to say, that's really interesting. How can we make that work, and how can we move on? And none of us as clinicians, or old clinicians, as in my case, know everything. But generally, we've got a resource that we can find, either a colleague or something that's available on the net, and find an answer. You don't know all the answers all the time.
Absolutely. And I think it's using those partnerships that's so important. I had a patient in clinic recently who said that one of the challenges they had, so I work in a critical illness capacity, I'm an intensive care nurse, that a patient who came home said, well, he called the wall of pillows in the bed, the Berlin Wall of pillows. And he said, the challenge I have is I can't get over the Berlin Wall. And when he first said it, I was like thinking, oh, I don't really know what you mean, sir. Tell me what the Berlin Wall means. And actually the Berlin Wall of pillows just meant that he had put pillows around his partner because he was so scared of hurting her.
Yeah.
And I think that's a massive thing for couples.